Very interesting question. It's actually a clinical scenario many of us see in our practice, right? And it is a scenario which we hope to never see. Honestly, it is something that we should never be seeing to make it more important, right? Like it's something a surgeon is afraid of. So, patient who's a known case of COPD underwent laparotomy for DU perforation. On day 4, he develops fever. Any post-op patient developing fever, you are scared. Here he's developed it on post-op day 4 and he's having some amount of hypotension. Fever with hypotension, dangerous finding. Tachycardia. Urine output remains adequate. As of now, it is okay. Means he's entering a shock state. He is passed stools multiple times. There is some abdominal bloating. Capillary refill is good. Extremities are warm. AVG shows mild acidosis. Okay, normally 7.35 is like the lower limit of normal. PaCO2 is again mildly like it's on the lower limit of normal. It should be 80 to 120. 76 is lower limit. SVO2, I don't know what this is, right? We never see SVO2, but you should know. For MCQs at least, and as a good clinician, you should know mixed venous oxygen saturation. Base deficit is elevated. Base deficit is elevated means you are in acidosis. So very simple. What is the scenario telling you? What are you trying to diagnose here? First is elevated base deficit means he is in acidosis. It means there is a hypovolemia or a hypoperfusion. It means you are tending to shock, right? You are tending to a shock state because there is a hypoperfusion. So one thing, there is a shock. Second thing, extremities are warm. Capillary refill is brisk. There is tachycardia, there is hypotension, which means which of these could be the cause of shock? Answer is early septic shock. In basal atelectasis, there is going to be hypoxemia. There should not be any hypotension. Hypoxia is fine. Tachycardia is fine. Fever is fine, but there should be no hypotension. Unless he's developed a bronchopneumonia, right? There should be no hypotension. Surgical site infection can cause septicemia, but they are not telling you local finding. They are just saying he's passed stool multiple times. Maybe he has a pelvic abscess. So SSI goes against it. Paralytic ileus, again, it's no shock. Should not cause shock. So best answer here, early septic shock. Now, what goes more in favor of early septic shock? Look at this number, mixed venous oxygen saturation. In a normal person, when I measure the oxygen saturation in a normal person, it is between 50 to 70%.